Padma Shri Award is for the unsung heroes. And you are treating such an expensive disease, sir. The treatment itself will cost so much, and you're doing everything for free. You yourself have been diagnosed with hemophilia.
Let us invite one celebrity.
Okay.
Celebrity. So
I
then
know.
we got appointment with Dr. S.P. Balasubramanian. Though I have started this with passion, but passion only will last longer. We need to inculcate professionalism. He was brought to us when he was 6 months old with an ankle bleed. We started our Haemophilia Society with 9 patient family. But what happened, it is a low volume, high cost disorder. The medicines were not available. Even available, they are very expensive. Hemophilia without disability, children free of pain.
Today we have a guest of high caliber, Dr. Suresh sir, who has received Padma Shri Award for his excellent contribution in the medical field and for helping people with hemophilia. Welcome, sir.
Thank you.
Sir, firstly, you yourself have been diagnosed with hemophilia. And despite that, when did you decide that you need to help others? Where did you get this thought from?
Actually, I was born in a known family of hemophilia. My mother is a carrier, and I had my mama, brother, maternal uncle, who also had hemophilia. And whenever we used to go for summer vacation, that is in Harrier, when he came to know that I too diagnosed with hemophilia, so he was telling these doctors doesn't know hemophilia. They have spoiled my joints and all those with all the wrong treatment. So he is insisting to take up medicine and become a doctor. But those days I was not interested in doctor medicine. I wanted to become a pilot. But one summer vacation changed the whole scenario. And he had a terrible headache and vomiting. And he took me along with him to the hospital, Secretary General Hospital. There he was telling that I have hemophilia. Please give me 2-3 units of blood so that I will survive. But the doctor ego got hurt, and he started asking so many questions, reports, and all those. And he told whether you are a doctor or I am doctor, you are asking me to transfuse blood. Show me that report. So ultimately, he thought it is a sinusitis, and he prescribed some antibiotics and painkillers, and pushed us out of the OPD. You know that there is in front of hospital, there is one Vishwesharaya Park. In the bench, he was lying down and plucking his hairs with severe pain. Even in that pain, he never forgot. He told that that's why you must become a doctor. So then we went home without any treatment, without any help. Later, after joining the medical study, my MBBS, I realized what will happen when there is a blood clot over the brain. He lost consciousness and half of the body paralyzed. The whole family had to witness him dying inch by inch. After 1 week, he died. So this experience, this one, no, his death made me disturb me a lot. And why? So then I determined at any cost I must take up medicine and become a doctor. I too have hemophilia, but with my parents' support, especially mother and the teachers. So I completed my PU in Bellary. Then I got um, government seat in private medical college, that is in JJ Medical College. So then I came to Davangere and I completed my MBBS. Then I realized my limitations. See, now because no factors were available during my childhood days, already my joints were crying. I realized what will happen after 10 or 20 years with crippling disability. So I thought MD pathology would be most suitable for me.
Mm.
because of the two reasons. One is I can involve in the field of blood and serve my blood brothers.
Mm.
And second point, even if worse disability occurs, I can set up a lab and sit in a corner and earn for my livelihood. These are the two reasons why.
Mm.
Then we started Karnataka Haemophilia Society in
Mm.
1989-90, and I'm really happy and proud to share with you that though I was doing my internship, and the it was not regular stipend,
Mm.
and once in
Mm.
a while it used to
Yes.
come lump sum amount. And the
Yeah.
first earning of my life,
Mm.
I registered Karnataka Haemophilia Society. That time
Yeah.
it was Chitradurga district. So
Uh,
this is how we started our Hemophilia Society with 9 patient family. But
mm.
what happened, it is a low volume, high cost disorder. The
Mm.
medicines were not available. Even
Mm.
available, they are very expensive, beyond
Mm.
the reach of common man.
Mm.
So, of course, we started with creating awareness, public
Mm.
awareness, media awareness, and but the main challenge was arranging diagnosis and treatment.
Mhm.
Then, I always tell, my students are my strength. So, being a teacher is really gave me a lot.
Mm.
So, the students, no, in 1996, actually, that
Mm.
was the two interns. Now he is in Bangalore, ophthalmologist, Dr. Sirish Nelvigi, and one is psychiatrist in Udupi, Dr.
Okay.
Bandari. So these two boys really changed the scenario, and they suggested, let us have one small program in our Bapuji auditorium to and raise funds. How
Mm.
long we can go after
Mm.
donors and plead for money and all those
Mm.
for poor patients, because many of the patients, though it is known as
Mm.
royal family disease, and
Mm.
the Indian hemophilics are very poor,
Mm.
and illiteracy again adds complexity. So
Mm.
that's why we wanted to organize this program to raise
Mm.
funds to procure these medicines from our Hemophilia Federation. We affiliated and
Mm.
started getting these not at free of cost those days, at subsidized cost.
Mm.
But anyhow, it was very difficult. So when a child with hemophilia
Mm.
lands up with a brain hemorrhage, first thing we need to give factor. If you
Mm.
give factor, the person will survive. If you
Mm.
don't give, he will die. Okay,
Mm.
but after the recovery, he says, "I'm coolie, I can't afford," and all those. So that
Yeah.
was the lot of dilemma situations we
Mm.
faced.
Yes.
For that reason, these boys wanted to organize a small program in
Mm.
Bapuji Auditorium. So that we called Kusuma 96. Kusuma
Mm.
in Kannada we call Kusuma Roga for hemophilia.
Uh,
So that's why we named it, and we went to different colleges, AVK College, the Arts
mm.
College, and so we told them we don't have money, but we can give you a chance to perform. So
Mm.
that's how it happened. Everybody got together, and we organized a program. We could
Mm.
raise
Mm.
around 2 lakhs rupees, and 1 lakh we got these expensive medicines
Mm.
and made stock of it. And yes, this is how the journey started. But because of the media reports and all those, a lot of patients started coming, even neighboring Andhra.
Mm.
So our responsibility also increased. Then so we thought, someone suggested, we decided to organize similar kind of program in 99. April
Mm.
17th is World Hemophilia Day. On that
Mm.
occasion, we planned this program. But this time, let us
Mm.
invite one
Okay.
celebrity. So
I know.
then we got appointment with Dr. S.P. Balasubramanian,
Balasubramanian.
and he told, I have just 10 minutes. You tell me what I should do, why you have come to Chennai.
Mm. Mm.
So when we told everything about the suffering children with hemophilia, expensive nature of treatment, and he was touched, and he told one word. So you are all doctors. Doctor, you have opportunity to serve patients directly. But I
Mm.
am not a medical doctor, but I have doctorate in music and singing. and give me an opportunity. Then our delegation, they were shocked too. Sir, we are not in a position to organize such a big event. That to yours, we can't afford expenses and all that. Who asked you this thing? Don't worry about it. You need not pay even 1 rupee. This is my social commitment. This is how our relationship started in 99. He came to Danagare, performed the show, and we could raise a substantial amount. And then we went with the balance sheet to Chennai, and he was surprised. And he asked me, why you are telling all this? I have given so many charity shows. You were the first one coming back and giving the accounts. Then, no, sir, our relationship should not end with this program only. You should be with us. Then, I'm always with you, doctor. You only have to tell me, and we are all busy. Definitely, I am always with you. And then I asked him, sir, you become patron in chief of our organization, Mahaposhaka in Kannada. And he jokingly told, by looking at my size, you want me Mahaposhaka. So this is the commitment he gave. Every year, I can give 1 day for hemophilia. It is not just for fundraising. Even if your children forget their pain, I don't mind coming personally and sing for them. This is the commitment he gave. And in his lifetime, 21 years, he stood with us. He gave, we could not organize every year. We are all volunteers, So college work and everything is there. We could organize 5 mega event, and that mega event really gave a very good strength to serve this community. And in the meantime, locally, Kirwadi Girichama Bapuji Education Association, now he's the vice president. And the local authority has allocated a site for our NGO. And we were finding it very difficult to adjust even the subsidized cost. But this woman, great woman, she told, this is also like a temple. I want to, don't worry. So she got that land to our society. And that's why I always tell, Girjamma got us a land, and SPB started singing from the bottom of his heart. And in over the years, so we could construct exclusive building, and what you have seen. And yes, and yeah, we have established all the facilities needed for blood disorders under one roof. We have a diagnostic lab. Even my diagnosis, I had to go to Mumbai. So diagnostic lab, even in 15, 20 bedded inpatient facility, and hydrotherapy, physiotherapy, and even blood bank also. Why we organize blood bank? I'm happy that you are part of this blood donation camps, and really I'm proud of you. And when you were in intern year, you worked for our society, and really great this thing. And see, blood bank, why we established hemophilia factor 8, factor 9 are there. But still more rarer bleeding disorders are there. Factor 13, 5% deficiency. For them, there is no specific factor replacement. We have to give either fresh frozen plasma, cryoprecipitate, platelets for gland medicine. So this is the only. So then, being a bleeding disorder community organization, in our board we have taken a decision to give all these blood and blood components free of cost to any. So any inherited bleeding disorder patient can walk in and get all these facilities at free of cost. Only the problem we are facing is diagnostic facility. The reagents, equipments are expensive. But anyhow, the very, very poor, unaffordable patients we give free, but not in general. Of subsidized cost of diagnostic services we are giving. Even 3 meals to the admitted patient and the attendant, we are giving free. So this sometimes I feel surprised. It's such a expensive disorder. So God enabled us to give all these services free of cost to the patient. And also I must acknowledge the support of our state government. We advocated with the state government, because earlier government was not involved. We advocated with the government. We met ministers, especially the health minister, Kagudu Timmappa. So many people know. So we invited him to Davangere.
mm,
and for one Bhumi Puja program. And that time, we had one family from
mm,
Sagara where
mm,
Kagodu Timmappa was a MLA, and now he is a health minister. There is a
mm.
family working in a coffee plantation, had two children with hemophilia. So one
Okay.
child, while eating chocolate, bitten lip
Mhm,
and started bleeding. And
mm,
bleeding, and even weeks together, bleeding did not
mm,
stop. By the
mm,
time they came to Davangere, someone has
mhm,
advised in
mm,
Shimoga, they came to Davangere. By that time, child was in shock, literally. And
mm,
we tried our level best. We could not save that child. Child died.
mm,
This
mm,
I told mother, your MLA is health minister. You have to tell your how you lost your child. So the
mm,
other child we supported, and now he is a college, is a youth. So
mhm,
when Kavuru Timappa, health minister, when he heard this story, then he
mm,
turned to me. You are calling Kusuma Roga, but what this one a child dies by eating a chocolate? What is this? What
mm,
government should do? Tell me. What are your short-term need? What are your long-term need?
mm,
Short-term need, I told the training of our doctors all over the Karnataka district
mhm,
wise. So immediately he arranged it, deputing three doctors from every district, and I arranged a training program in Bangalore Training Institute. So this is what. Then the next question is very important. What is your long-term need? Yes. So long-term need is, yes, these medicines, sir. These are all not available in India, not manufactured in India. They have to be imported. But even middle class families cannot afford. I gave my own example. I am working in a medical college, though I have a salary, but
mm,
if I bleed two, three times, nearly 75% of my salary will go for treatment. Then what about a clerk having a child with hemophilia?
mm,
He
mhm,
neither comes under PPL or. So then he realized, he understood he instructed the principal secretary to move the file. This is how he initiated. And by the time in 2005, first time in India, the state government announced the procurement of these medicines and make it available in all district hospital in phases.
mhm,
Now we
mhm,
have all these district hospital with these medicines, and
mm,
getting these patients getting treated here.
mm,
And this is how the advocacy happened. And during that time, government realized our efforts. They
mm,
also included us in providing these medicines. So that's
mm,
why I always tell, government supports us in providing these medicines, whereas other rehabilitation awareness, then education support, economic support,
mm,
and all these, even organizing rehabilitation camps,
mm,
everything
mm,
we do from our society. So this is
mhm,
how we are trying to realize our vision. Our vision is hemophilia without disability, children free of pain.
yeah,
So we started dreaming whether it is possible to have hemophilic without disability. Definitely, it is possible, because
mm,
the even there is advent of therapeutic agents.
mhm,
Nowadays, we call non-factor therapy, that
mm,
rebalancing of hemostasis. Okay,
okay,
so these drugs, no. So earlier, whatever the factor they lack in the clot in their blood
mm,
has to be
mhm,
replaced at every
mm,
instance of bleeding. Universally, there are two kinds of treatment:
mm,
on-demand treatment. In our country, because of various issues, we preferred on-demand treatment. That means whenever he sends bleed, we give factor. But
mhm,
that is that we failed in preventing disability. Whereas in Western country, they call prophylaxis.
okay,
Prophylaxis is the gold standard treatment as per the World Federation of Hemophilia.
mhm,
So that is prophylaxis, means whether they bleed or not, periodically you give factor. Okay.
mhm,
But now there is one more advancement, as I told you, non-factor therapy. And
mhm,
non-factor therapy advantage, because
mm,
these factors has to be given
yes,
IV. You
mm,
have to look at veins, especially in children,
mm,
it's very difficult. So
mm,
whereas this drug, he has got spectacular advantages. Number
mm,
one, they can be given subcutaneous. They can be
mm,
given. Whereas the anti-hemophilic factors have fixed off life. That's why you have to
mm,
give factor 8 hourly, 12 hourly like this. Okay, if it is a
Mhm.
CNS bleed and so whereas this medicine every month one injection, long
Mhm.
half life. So this has revolutionized the treatment of hemophilia,
Mhm.
and that too, these medicines we can achieve zero bleed.
Okay.
As earlier, zero bleeds, okay, prophylaxis, but
Mhm.
ultimately zero bleeds was not so successful with the previous mode of treatment. Whereas this medicine, we can achieve zero bleed. Zero bleed means what? No bleed, okay, bleed
Mhm.
free hemophilia, and naturally disability free.
Basically
And the
free.
main problem is our children cannot go to school. School
Mhm.
absentees is very common, and they cannot achieve good education. And in
Mhm.
this world, in this era, the
Mhm.
without any good education, how can they compete in the world for
Mhm.
job and their
Yeah.
placement? So that's why this with this medicine, no, so
Mhm.
we can achieve even disability free hemophilia and
Yes.
quality of life. They can get good education. We lack only clotting protein in the blood, nothing else. We are equally competent, skills,
Mhm.
capability, zeal, everything is there. Only government or the society has to give us a conducive atmosphere. Conducive atmosphere means bleed-free environment, so that we can also achieve, we can also become anything we
Mhm.
want and become productive citizens of this country. So that has happened in 25th of this February. No, that's what
Yeah.
I feel so much after this Padma Shri. Really, this month we could realize so many of our dreams.
Mhm.
So uh, the principal health secretary Harsh Gupta and our honorable health minister Mr. Gundurao and our Deputy CM DK Shivkumar, they understood our problem and
Mhm.
they launched this program officially on 25th of February in
Yeah.
Bangalore. Okay, so this is
Mhm.
one dream we achieved, vision we achieved, and our community can be confident that
Mhm.
free, disability free, uh, the atmosphere, and they can achieve. Okay, we are
Mhm.
confident now. And another thing I wanted to share is, you have seen, you have gone in that van also,
Yes, sir.
mobile service unit. Okay, we
Yeah.
mobile service unit was conceptualized because I have seen many of my blood brothers succumb to bleed in the road
Mhm.
while
Mhm.
reaching Jamagere. Okay,
Mhm.
that's why we started this for
Mhm.
125-kilometer radius. And
Wow.
if any of our hemophilic
Mhm.
we train them how to sense earliest sign of life-threatening bleed. For example, severe headache and projectile vomiting is a sign of a
Mhm.
CNS bleed. So that
Mhm.
time they need not to come take any vehicle or take bus and car reach Davangere. They
Mhm.
can pick up their mobile and call our mobile service unit.
Mhm.
Our mobile service unit will rush to his house and give factor and bring him back in the same vehicle for further management. So
Mhm.
this concept we were working nearly 4 5 years. We wanted to gain experience, pros and cons, and submit a proposal to replicate this all over the state, every
Mhm.
district, because 108 emergency there.
Mhm.
Principal secretary was so much convinced. He told,
Mhm.
why to wait till that time? We can immediately start. These
Oh.
two these two projects, I am really proud and happy to share with you. 25th of February in
Mhm.
Bangalore, these two projects were launched officially, inaugurated
Let's.
officially by Deputy CM and Honorable Health Minister. Health Minister is so, you know, down to earth, and he understood and he responded so well
Mhm.
the pain of our hemophilia community.
Mhm.
And definitely, we are seeing the change now.
Yes,
Oh,
sir. So you share a very special bond with Shri S.P. Balasubramaniam, sir. If
yes.
today he was there, what would you
Yeah.
convey to him?
Actually, when he was there, no, he used to tell me
Huh.
why the government is not recognizing you, and I will take you. I will you by this
Yeah.
time you should have got this award,
Mm.
that award. So uh, you used to tell me every time. I miss him a lot. Actually, if he would have enjoyed a lot. Anyhow, he blesses me from heaven, and we always because the if SPV is not there and Kirwadi Girijamma was
Mm,
not there,
mm.
definitely it would have been a very difficult task for us to achieve whatever we have done today.
Indeed, sir.
Yeah.
They say that Padma Shri Award is for the unsung heroes. And you are treating such an expensive disease, sir. The treatment itself will cost so much, and you're doing everything for free. You stayed back in Davangere, whereas you had an opportunity. You could have gone out, you could have made money, but you stayed back to help people. I mean, there would have been something which would have made you stay back. They say that money cannot buy everything. What made you feel that?
Actually, when I was doing my PUC, one of my mathematics teacher used to tell me,
Mm,
we should never be after money. If at all, if it
mm,
want, it should come
mm,
on its own. So this
mm,
principle I follow. So
mm,
we should never be after money. So money will definitely come if you
mm.
put your efforts, if you are sincerely work. No, definitely it will come. But the change because being born with hemophilia, have
Mm.
seen my mama. I know death, helplessness, death, and also my suffering. I have become disabled now. This would have been prevented if
You're not
all
disabled,
these
sir. You are helping everyone. You have turned that into your strongest power right now.
Thank you. That's why I took it as a challenge. I must also share with you. You know, my
Yes,
wife,
yes, sir.
Mira.
Yeah.
Even everybody will get that after my
Mm,
job. Family started pressurizing me for marriage, but I never wanted to marry
mm,
because of all these commitments. The then whichever proposal comes now, I used to tell openly that I have this problem that blood doesn't clot and all those, expecting that they will reject. But
mm.
when Mira proposal came, the whole family appreciated my open-mindedness, and they thought, even any accident also causes disability. But your open-mindedness and frankness really we like. And
Indeed.
in fact, to tell you, after the marriage, Mira, she preferred to become clinical psychologist. She did some
Oh,
courses, and she
mm,
opted to be psychologist because she thought
mm.
she can help me by
Yeah.
taking up that counseling, education, organ
Mm.
administration. I think you have seen how.
Yes, I have interacted. Mom is
Yeah, yeah,
very strong, the
yeah,
backbone
yeah.
for their
So
institution.
yeah, yeah, because I work in college and this is my voluntary work, and so both of us shared the responsibility
Mm,
to run
mm,
this organization. And at least there are so many calls more than
mm.
me. Mira. She gets mothers, children, and yeah, she enjoys that. And we decided not to have our own children because if
But
we
you
have our
have so
children,
many children, so everyone that you have
yeah, yeah,
treated
that's
are
what.
your children.
Yeah, yeah. So she told, no, if we have our own children, so many
Mm,
obligation will come to make property and all those things. So let us consider all our this hemophilia
mm,
community as our children and work for their welfare. And more than me, there is so much of sacrifice and hard work from my wife also. And in the meantime, no, I think you know Naveen Hawali. So actually, Naveen, he was brought to our center when he was 6 months old with an
mm,
ankle bleed, and
mm,
that's how he used to come for treatment. And he completed his BCom and MBA. Then his parents, even he suffered two CNS bleed also,
mm, mm,
survived CNS bleed. So his parents started thinking because they have seen how we were struggling to
mm,
balance profession as well as
mm,
my commitment. So
mm,
they suggested you need not go for any job. You take full time responsibility of
mm.
KHS. Then I told, no, it is his life also. Then we decided to appoint him as a full-time executive officer. So after his appointment, no, we have seen lot of change. Like because for any organization, though I have started this with passion, but passion
Yes.
only will last longer. We
Yeah.
need to inculcate the professionalism. So that's why what Naveen and Mira, so both are involved in setting up of all policies and comply with the regulations of the land rules and regulation. That's how we are eligible for CSR and so various support. And he is working on and successfully got some projects also. So what I'm telling, because see, compare with me as well as Naveen, I'm disabled, but Naveen is not allowed to become disabled. And if
Mm.
this non-factor therapy comes, no, none of
Mm.
our hemophilics will become disabled, and
Mm.
they can achieve anything they want in their life. So
Mm.
this is the change or KHS has brought in the hemophilia community. And yeah, after this Padma Shri, yes, Padma Shri was unexpected.
What
And
was
this
it
Padma,
when they called you out for Padma Shri, sir? What thought did you get in your mind?
no, actually, I came to Nelmangala for one marriage of my friend's son.
Uh,
So I received a call. We are from Ministry of Home Affairs. The union government has recognized your services, doctor. Congratulations. And you are being conferred Padma Shri. Then I was really, my heartbeat missed actually. So what is then they asked, we need
uh,
your consent. Really consent. So this gives an ample opportunity for me.
mm.
Now I will be empowered to take up some more challenges. It is an encouragement by the government.
Hats off, sir. Hats off to the entire team. Hats off to you, Meera ma'am, and the entire Karnataka Haemophilia Society. And with this, with a difficult, even though I don't want to end this because talking to you was so pleasant, I can keep listening to the inspiring journey. Thank you so much, sir. Like you are treating such a rare disorder which requires expensive treatment with so much ease, and you're making this all look very easy, but we all know what the work it goes behind it, and you yourself are struck with hemophilia. You have to challenge, you have to manage your own battles, and you have to take care of the entire community. And hats off to Meera ma'am as well. And I urge everyone who wants to help Sir can join the Karnataka Haemophilia Society, can volunteer with awareness, blood transfusions, can donate blood. It would be a great measure. Please, please join, Sir.